Hi Girish.
Hey Thiru.
Can you introduce us to the issues in the space of maternal and infant care today?
In India, if you look at the statistics around maternal and infant care, it's alarming. For every 1,000 childbirths, 2 mothers die and more than 42 babies die. And mind you, this is only mortality during childbirth. And if you were to expand the statistics a little beyond that, on how many go on to live for the first 5 years, how many are on low nutrition, how many mothers were able to breastfeed the baby within the first hour, or even how many get timely vaccinations or immunizations, the problem just blows out of proportion. So the real problem is healthy mothers, healthy delivery, and healthy babies after that. So achieving safe childbirth is the mother of all problems. So if you were to put economics aside, the key challenge would be to modify people's behaviors through the right types of awareness. So what kind of actions is desirable for the right outcome in this space? The right actions would be improved diet. The right action would be timely vaccinations and immunizations. And most importantly, seeking institutional deliveries. These three become the right actions for the outcome that we're seeking for. So if you look at caregivers, we have private as well as public caregivers who have their own healthcare delivery models. And these models, although they are put in place in the right meaning, the big challenge is to be able to track the efficacy of these healthcare delivery models, whether it's with respect to financial efficacy, whether it's operational efficiency, or most importantly, clinical efficacy. And here's where a technology such as digital health could come in and play a crucial role.
It's interesting that you mentioned digital health. Can you tell us something about digital health and how do you think it will make our solution stronger?
Right. So digital health is nothing but the coming together of the big healthcare and health problems or gaps and the big leaps in technology. So when these two come together to solve the right problems, that is digital health. So if we look at what it can do, it can get data through the right sensors of data of the patient. And then that data can be analyzed using analytics for meaningful information. And using connectivity and mobiles, the right form of interventions can be given at the right time. So this can avoid several dangerous outcomes. A dashboard is something that can be used to visualize the entire window from conception all the way to the baby turning into a young adult. It's not particularly a solver of challenges, but it's an observer of challenges. So once you start observing the different stages of the healthcare delivery model, it becomes a tool for us to quickly look at gaps, for us to quickly look at how the implementation has been, and to start looking at the efficiencies of the delivery mechanism.
So this would be a collection of data that would be presented according to who is looking at it. Maybe for a doctor, vital information to a doctor, and suppose it's a nurse, then whatever is relevant there.
Absolutely, the right metrics, the right data that you want to track, presented in an appropriate format.
Can you give us some specific examples on what kind of problems we have and how technology can help in solving this?
Sure, yeah. I think if you look at challenges or issues at the moment, there are so many. The first one could be if you look at an NICU, where babies that are born typically kept for the first 3 days, and sometimes they're kept there for weeks together. There's a big problem of hygiene. So obviously the family members are excited. The extended family members are also excited. They want to come and see the baby. But it's important to maintain the hygiene. We've seen some solutions where a nurse walks around with a web camera showing the baby, and the family members are able to see the baby from outside on an LCD screen. So that's a fix for the hygiene challenge. There could be other issues, nutrition, starting from conception for the mother, as well as to the baby as it grows into a young adult. There needs to be enough awareness and enough motivation for them to work on the right nutrition. That's a big piece. We can do that through SMSs in regional languages, for instance. There could also be delivery, right? One in every 4 births in India happen at home, and that's again, not the best thing. So there could be a build-up of awareness through various interesting campaigns, and help people modify their behaviors to have institutional birthings.
So to sum it up, I understand that digital health in maternal and infant care will enable us to get better and faster feedback. We'll be able to verify if the outcomes that we intended are being felt, and most important of all, it'll help us make faster and better decisions. Am I right?
Absolutely. Better connectivity, better interventions, better messages out to the patients. All of that is going to